Good afternoon, everyone. So we're going to get started in just a few minutes. We're waiting for a couple more people to join. But while we're waiting, can you please take a moment to make sure that your sound is working and that you can see the title slide on your screen? If you have any issues, you can use the chat and let us know, and we'll be happy to help. So while we're waiting, if you guys want to introduce yourselves in the chat, please share your name, organization, and where you're joining from. And also take a minute to think if there's any topics that you would like to see for professional development webinars in the future. All right, so good afternoon, everyone, and welcome to the VectorED Academy. This is the Vector Bite Risk Reduction and Field Safety webinar. This is hosted by the VectorED Network, which is a CDC-funded vector-borne disease training and evaluation center. My name is Dr. Danielle Tufts, and I'm at the University of Pittsburgh. And I'll be moderating the webinar today along with Olivia, the VectorED program manager. If you'd like to know more about the VectorED network and other programs, evaluations, and trainings that we have going on or what we have coming up, please visit our website and I will drop that into the chat. So this series was developed to support professionals like those in extension, public health, education, and all related fields who work to translate science into practice. So we recognize that while there are many of us that have deep subject matter expertise in vectors and vector-borne diseases, we don't always have the opportunity to strengthen the communication, design, and evaluation skills that help our work make the biggest impact. So each month, this series highlights a topic that builds those applied skills. So we try to have sessions be practical, resource heavy, and interactive whenever possible, with examples drawn from vector and vector-borne disease contexts to keep things relevant and real world. So to keep in touch for future events, we would like to invite you to connect with us on our LinkedIn, as well as sign up to receive more information about upcoming events through Penn State Extension and connect with our VectorED newsletter. So I've added those links into the chat. All right, so please note that this session will be recorded. You will also receive a link to the recording following the presentation. This webinar will also be posted to YouTube and our website with additional resources linked so that you can extend your learning. So a few housekeeping items. If you're new to webinars, this session will run for about 60 minutes total, with roughly 45 minutes for the presentation and time at the end for discussion and Q&A. All participants are muted to reduce background noise. If you experience any audio issues, check your settings. Use the arrow next to the microphone icon. You're welcome to post comments or reflections in the chat at any time. If you have a question specifically for the speaker, please use the Q&A feature to make sure it doesn't get lost in the chat. Live captions are available. To turn them on, click on the CC, the closed caption button on your toolbar. If you need to step away or leave before we wrap up, you can click Leave in the lower corner of your screen. Doing so won't interrupt the session for anyone else. We encourage you to participate, respond to prompts, share examples, and use the chat to connect with others. This series is meant to be an interactive and practical experience, so your input is always welcome. And now I'd like to introduce you to our panel of speakers today. So along with myself, we have Drew Leisiger and Emily Struckoff, who are vector-borne disease educators from Penn State Extension. Erica Mochtinger, who is an associate professor of entomology at Penn State, and Becky Trout-Frexell, who is a professor of entomology at the University of Tennessee. So today we are breaking the talk into three different layers focused on different components of vector-borne disease field safety, including understanding risk, assessing and preventing exposure, and communicating and improving field safety. We will wrap up with a summary and then open it up for questions. So the purpose of our webinar today is to really connect basic vector awareness with practical field safety planning. So we really welcome our broad audience today with a lot of different levels of expertise. The content will be presented that we'll be presenting today will move from more foundational information into operational and supervisory considerations. So our goals for this webinar are to establish a shared understanding and provide tools that can be applied across different organizations and field settings. So this isn't going to just be a review of vectors and their diseases. This is more aimed to focus on translating vector knowledge into safer field practices. So with that, I will let Drew take over the presentation.
Great. Thank you, Danielle. So yeah, today I'm going to break down the major vector groups in the United States. I'm going to focus primarily on ticks and mosquitoes, as they're going to have the highest number of vector-borne disease cases associated with them, but I'll also talk about other biting flies, kissing bugs, fleas, lice, and others. So this is a big lineup. I'm just going to go over each group very briefly because, like we mentioned, this is primarily going to focus on assessing risk and field safety. So I'm going to try to tie each of these groups into their risk while working in the field. So with ticks, we're thinking about exposure pathways, usually through contact with vegetation, animals, or animal bedding. So thinking about when in the field, you're probably going to come into contact with these ticks when you're rubbing up against vegetation, or if you're working with animals directly through the contact with those animals or their bedding. Primarily, ticks are going to be associated with wooded edges, brushy areas, leaf litter, tall grasses, and forest understories. So, kind of getting back to that vegetation. And as I mentioned, ticks and mosquitoes are probably going to have the highest number of vector-borne disease cases associated with them in the United States. So these are things like in the Northeast, especially thinking about Lyme disease, but other associated pathogens include anaplasmosis, Rocky Mountain spotted fever. I think someone mentioned in the chat that they have alpha-gal syndrome. This is also known as the red meat allergy. So this can cause allergies to mammal products. And then ticks can also transmit some viruses. So things like Powassan virus, which can cause encephalitis, or bourbon virus. Next up are our mosquitoes, probably the second most important group in the United States for vector-borne disease. Uh, Depending on the time of day, you're going to have a different species being active. So there are some mosquitoes that are active at night, some active at different times of the day. Some might be active all day or all night. But usually you're going to be exposed to mosquitoes as the females come to bite. So they're going to fly in, land on exposed skin. If you're wearing tight clothing, they may be able to bite through that clothing. So getting to that risk assessment and ways to prevent bites later on, that's one thing to think about there. Many species of mosquitoes are going to remain near their breeding sites. So these are going to be areas that have standing or slow-moving water. As many of you are probably aware, mosquitoes require water for the larval and pupal stages of their life cycle, but some adults may travel for miles from breeding sites. So if you're in an area that's relatively dry, but you're a few miles away from maybe a salt marsh, you may still be at risk for mosquito bites. One of the most common mosquito-borne diseases in the United States is West Nile virus. Some other ones include Eastern equine encephalitis virus, as well as lacrosse virus. And in some parts of the United States, dengue has started being transmitted locally some years. And so you want to be aware of location and a potential risk from different mosquitoes and the viruses or pathogens they can transmit. For some of these other groups, I'm going to be going more broad. So when we're thinking about other biting flies, these can include horse flies and deer flies pictured here, as well as sand flies, black flies, biting midges, and depending on if you're working with certain animals, these can be things like deer keds or louse flies. Uh, for exposure, this is going to be similar to mosquitoes. A lot of cases, if these are flying flies, they're going to fly to a host and then they're going to bite exposed skin. A lot of these flies can also bite through tight-fitting thin fabrics, but for some of these really small ones, that might be a little bit more difficult. Once again, a lot of these flies are going to require water or more moist environments for larval development. So, similar to mosquitoes, if you're near bodies of water or areas that contain water, so things like tree holes, you might be at risk for being bitten by things like biting midges or black flies. For associated diseases and conditions, generally, most of these are going to be, at least in the United States, they're going to be pests and nuisances that have painful bites that can cause inflammation. For human-associated pathogens, they tend to be rare in the United States. But something of note in the past couple of years has been Oropouche virus, which is primarily endemic to South American and Central American countries, but there have been travel cases in the United States. And so this is a virus that can be transmitted by biting midges. For our kissing bugs, the primary exposure here is going to be through nocturnal bugs biting sleeping individuals. So if you're working in the field, you may not really necessarily encounter these or be at high risk of being bitten by them unless you're in the areas where these bugs are endemic and maybe you're spending nights in the field. Some species are associated with human housing, so they can't enter through unsealed or damaged entrances. But other species you may come into contact with if you're working, near rodent and animal nests or dog kennels in the woodpile or debris. The primary pathogen of concern here is Chagas, or the trypanosome that causes Chagas disease, which may be endemic to parts of the southern United States, but is endemic to much of South and Central America. And then I'm going to end with fleas, lice, and other biting arthropods. So thinking about things like biting mites or non-tick mites. A lot of the times these are going to be closely associated with animals and will bite humans secondarily. For some of the human-associated lice, these will primarily be in human clothing and bedding, so they will target humans primarily. These are things like body lice and head lice. But a lot of the times you're going to be bitten secondarily by these if you're working with animals that these different organisms are associated with. Biting mites might also be picked up through soil, vegetation, or nesting materials. So these are things that you might run into even if you're not working with animals. Thinking about that exposure, a lot of the times these are going to be found in the bedding and nesting materials of the host. So I mentioned human lice, they're going to be found in clothing and bedding of human habitation. Some of these nest-associated mites might be found in bird nests and might bite humans secondarily. And a lot of fleas will also be on these animals or in their nests. For associated pathogens and or diseases and conditions, these are things like flea-borne typhus, plague, which is a concern in some Western states still some of the time, and then louse-borne or epidemic typhus. And then a lot of these bites from these different organisms can be very irritating. So that overview is really quick. We're not going to get really into the vector biology, but this ultimately leads to who is at risk of bites. If you're a person who's going into the field a lot, or you enjoy recreating outside a lot, or you're supervising those types of employees, those people might be at higher risk than people who work in the lab or stay inside. And so thinking about domestic bite risk, it's not always about travel. If you're in Pennsylvania like we are and you are going outside into the woods, you might be at higher risk of contracting tick-borne diseases because you're going to be running into a lot of black-legged ticks in these forests. Then maybe if you're going to a conference somewhere where there's some other vector-borne disease like dengue, especially if you're going to a hotel and you're staying in the hotel the whole time. So it's not always about distance. It's more about different types of exposure pathways and the amount of time spent in these different areas. And so to talk more about that, I'm going to pass it over to Emily, and she'll talk about more about these different risks and assessing those.
All right, great. Thanks, Drew. And thanks everyone for tuning in today. We really appreciate you taking the time out of your schedule to be here. And so to move into the next section of this program, I'm going to be talking a little bit about risk. So how do we determine if you are spending time outdoors, if you're conducting field work outside, how do you determine if you are going to be potentially at risk of vector bites? And to talk about this, we're going to split this up into 5 different factors or things to keep in mind, those being the season that you are doing work, the location, habitat, activity, and duration. And like Drew said, just make a note here, I am going to keep this pretty broad in general because we have a lot of folks here on the call from a lot of different places. But if there are any more specific questions that you have, if you're developing any resources yourself and want to know more specifics, feel free to ask about those at the end during the Q&A, or also feel free to shoot any of us an email. We are happy to chat and get you the answers or direct you to somebody who would know the answers. And so with that, to get into this, the first thing we're going to talk about is season. And season is just the time of year that you are spending time outdoors doing work, and that will impact your potential risk of getting a vector bite. A lot of the times, the warmer it is, the higher vector bite risk may be, but that's not always necessarily the case. And the season can affect a lot of different things. It can affect the number of vectors present, it can affect when they bite, or how aggressively whatever vector you're working with, whether it be ticks, mosquitoes, some other kind of biting fly, how aggressively they're going to be seeking out a host to bite and to feed on. So as an example of what this would look like, the graph down at the bottom of the screen there is showing roughly the seasonal activity for black-legged ticks in the northeastern United States. Black-legged ticks being the species of tick that can transmit the bacteria that causes Lyme throughout much of the eastern US. And then on that graph, we have the time of year from January through December and the different life stage of the tick. So the larvae, the nymphs, and the adults. And you can see looking at the graph that a lot of these ticks are going to be quite active in the spring and summer months, but the adults could also be active into the fall. So the time of year that you are doing field work, spending time outdoors, can impact whether or not you're likely to come into contact with these tick species. Another thing to note here is, like I mentioned, that graph right there showing the seasonal activity for black-legged ticks in the Northeast, because seasonality of vector species is very often going to be influenced, at least in part, by the location of where you are. So different vector groups or different vector species are going to be found in different geographical regions. So when we're talking about location, we're talking about the very broad geographical area right here. So over on the right are, once again, 3 common tick species that often bite people throughout the United States. At the top right there, we have black-legged ticks, in the middle, American dog ticks, and at the bottom, Lone Star ticks. And those maps on the right are just showing their general range. So that's something to keep in mind of depending on where you are working, either in the US or outside the US in another country. The location where you are can determine what potential vectors may be in that area. Location alone is not going to determine risk. It will just determine what vector groups could potentially be there. For example, you could be doing field work in the upper Midwest, say up here, well within the range of black-legged ticks, but not encounter any of them. That is very possible. And that is where some of the other factors of risk come in, like habitat. And so when we talk about habitat, this is going to be a little different from location because this is referring to the very immediate environment where you are working or spending time outdoors. And different habitat factors can influence the chances of a different vector like a tick or mosquito to be in an area. So for example, if you look at this top left photo right here, we have a kind of pastured environment. There's some brush on the ground, and that brush could potentially be really great tick habitat. And that is one factor that could potentially influence the abundance of ticks there. Versus if we go to a photo a little bit below here where we have a lake, we have a bit of a swamp, we see a lot of plants, maybe a boardwalk type situation here. That standing water could potentially indicate that there might be mosquitoes in the area because that standing water could be really great mosquito breeding habitat. So keeping in mind these different habitat factors, things like vegetation height and density, the presence of standing water, if there's a lot of leaf litter, if you're going to be in a really forested area, maybe a lot of canopy cover that's super shaded, those are all different things that can influence the potential for a vector to be in the area. And so moving right along, going on from location and habitat, another thing to keep in mind is not necessarily where you are, but the activity that you are going to be doing in that area. So there are certain activities that could potentially put you at higher risk of coming into contact or being bitten by a vector, as opposed to doing other activities. So in the example here, we have two people who are both spending time in the woods. So similar habitats, similar location, but doing very different things. On the left, we have somebody who's going on a hike on an extremely well-maintained trail. Truly, it's very rare you find trails that are quite that well-maintained. It's very nice. But as you can see, she's walking down that trail, and she's not really coming into contact with a lot of really vector potential risky area. The trail is very well maintained. It's very separated from that grass, that brushy area where ticks could be. And so that's going to be a bit of a lower risk. Even though she is hiking outdoors, she's not really coming into contact with that area. Versus on the right, we have somebody who is doing field work. If anyone here is collecting ticks, you'll recognize, has collected ticks before, you'll recognize she's tick dragging in that photo. And you can see that she is very much kind of in the woods around a lot of potentially very good vector habitat. So that activity could increase her risk of being bitten by a tick or another vector. And the last thing to keep in mind here when we're talking about risk is just duration. So the amount of time that you are spending outdoor in vector risky habitat. The longer you're spending outdoors, the higher risk you could potentially be at getting a vector bite. Another thing to keep in mind with duration is that there are certain personal protective measures that we'll talk about in a sec that may need to be repeated or redone if you are spending longer periods of time outside. Doing things like reapplying repellent, doing multiple tick checks may need to be done if you are spending, like I said, extended periods of time outdoors in this potential vector risky habitat. So with that, now that we've talked a little bit about risk, what would potentially put someone at risk of being bitten by a tick, mosquito, or other vector, what steps can you actually take to prevent vector bites? So if you're spending time outdoors in these areas, you look at the habitat, you look at the season, the activity you're doing, and you think, hey, I may be at risk of being bitten by a tick, mosquito, or other vector. What steps can you actually take to prevent bites? And so I'm going to talk about a bunch of different methods or things that you can do. And to help organize this and break it up, we're going to be talking about them and things you can do before you go into tick or vector risky habitat, things you can do while you're outdoors, and things you can do after you come back inside. So to start off with things you can do before, the first thing is probably something you've heard before, which is just that if you wearing clothes like long pants, long sleeve shirts, long socks, can help prevent vectors from getting onto your skin. So the more barriers there are to prevent bites, the less likely you are to get bit. So doing things like wearing long pants or long sleeve shirts, tucking your socks into your pants or your shirt into your socks to reduce access points can help reduce your risk of getting bit. Another thing to keep in mind, if anyone here is working in a supervisory role, maybe you're managing folks who are doing work outdoors, depending on where you are and what you're doing, using coveralls or other PPE may be a good idea, may be necessary to help prevent some of these bites and provide that other layer of protection. Another thing you can do is treat clothing with permethrin. So if you haven't used permethrin before, it is a product that is used to pre-treat clothing before you wear it. So essentially what you do is you take the clothes that you want to wear outside to do field work, you take them outside, lay them on the ground on a tarp, like is in that first photo right there, and spray it down with permethrin. That is what the bottle is right here. You can see this person is spraying the permethrin on these clothes. You spray the clothes with permethrin so it gets slightly damp. And once it is slightly damp, you hang it out to dry. And then once it's dry, it's ready to go, it's ready to wear. So this is a little bit different than some other insect repellents that we'll talk about in a sec, because you do not apply it directly on your skin or on your clothes when you're wearing them. It is used to pre-treat clothing before you wear it. So why would you do this, and why would this be, a potential option to take? First thing is that this is a product that works to keep ticks, mosquitoes, and other vectors off you by contact. So essentially what happens is that if you are wearing clothes that are treated with permethrin, and let's say a tick were to crawl onto your pants, the permethrin will cause the ticks to fall off of this clothing before they have a chance to attach. So it can be very effective at getting ticks and other vectors off of you before they have a chance to bite. Like I mentioned before, this is used to pre-treat clothing before you wear it. So you do not apply it while you're wearing it, you do it beforehand. One reason why you may choose to use this is also because of how long it lasts. Clothing that you treat at home with permethrin, like is being done in this photo, will last for up to 5 washes. So it is not something that you need to redo every single time you go outside. If you are consistently wearing the same clothes outside, so maybe you have a uniform you're wearing outside all the time, you have a pair of field pants that you are always wearing, you can treat your clothes once, kind of set it and forget it, and be good to go for a while. One note I will make here about permethrin, if you are using it to treat your clothing, is that when it is wet, permethrin is toxic to cats. So if you're doing any of the treatments yourself, if you're treating any of your own clothes, you just want to make sure that you're doing that away from any cats in the area and that the clothing is kept away from cats while it dries. But to give you a visual for how this works, on the next screen, we have a video, and whoop, sorry, I went ahead a little bit. And what this video shows, let me go back a little bit, is on the left side is a pant leg that has not been treated with permethrin, and on the right is a pant leg that has been treated with permethrin. And the little dots at the bottom are all ticks. And as you can see, as the video goes, you can start to see the ticks on the right drop off of that pant leg as they're exposed to the permethrin. So as they come into contact with that clothing that's been treated, they're falling off before they have a chance to attach to a person. So moving right along for things you can do while you're doing field work, is up on the screen right now is talking about insect repellents. So there are a lot of insect repellents that can be used to prevent tick, mosquito, and other vector bites. And what that video on the left is showing is that there is a tick who is walking along this piece of paper. And if you see this part here that's a bit darker, that is has been treated with an insect repellent. And so how repellents work is they're very simply used to keep away ticks, mosquitoes, and other vectors, to repel them. So you can see that tick, it's going towards the DEET on the piece of paper, and then it senses it. You can see it start to walk there and decide, no, actually, I don't want to be there. I want to get away from it. And so there are a lot of different insect repellents out there that are available that you can use. And when you're trying to look for a repellent or figure out what you want to use, we always recommend looking for a repellent that is EPA registered. Repellents will have on their label an EPA registration number, which will tell you A, that it is registered, and B, what the active ingredient is. The active ingredient is essentially the component of the repellent that is really doing the work of repelling whatever vector it is. So up on the screen are some of the common EPA registered repellents that are out there. The first one on the list is DEET. If you've heard of one insect repellent before, it's probably DEET. It has been around for the longest. It's got the most safety, efficacy data behind it, and it can be very effective at preventing a lot of different kinds of vector bites. But there are also other active ingredient repellents that you can use other than DEET. There's picaridin, which has a very similar efficacy to DEET, but without the kind of greasy texture and the smell that DEET has. So if you don't like the texture or the smell of DEET, picaridin is another option that works similarly. IR 3535 is another repellent that you can find, as well as oil of lemon eucalyptus. One note I'll make about oil of lemon eucalyptus on here is that this is specifically referring to repellent products that contain oil of lemon eucalyptus, not the essential oil. They're a bit different, they're formulated a bit differently, they work differently. So if you're looking at repellents, you're looking to kind of see what's available. If you're looking for something with oil of lemon eucalyptus, you want to find an actual repellent that contains that active ingredient, not just the essential oil. But take-home message here is that there are several different active ingredients that can be effective at preventing these tick and mosquito and other vector bites. So moving on to things that you can do while you're in the field, one trick here is for ticks specifically, if you're going to be in an area that you know is going to be very, very ticky, like you're doing work in a prairie, you know there's a ton of ticks there, you can use a lint roller or a piece of tape to stick the ticks off of you before they have a chance to attach. This can be really helpful. I don't know if anyone's ever found themselves in the situation before where you're walking through a field or something, you look down, you have a ton of ticks crawling on you and you try to brush them off real quick, and then you don't know where they went. You don't know if they're on your hand. If you got them off, you're not sure. This can be really helpful in those kind of situations to very, very quickly get those ticks off of you. These will not remove attached ticks. This is only for ticks that have not attached yet and are still crawling. Another thing you can do once you come indoors, so transitioning now from you've been outside, you've been doing field work outdoors, what can you do even after coming inside to prevent a tick or a tick bite? One thing you can do is take a shower and put your clothes in the dryer. So taking a shower within 2 hours of coming indoors can help wash away any ticks that may be on you but haven't attached yet. And placing clothing in the dryer on high heat can help kill any ticks that may have hitchhiked inside on your clothes. The heat from the dryer will kill them. Another thing you can do here is do a tick check. So if you've heard of one thing to help prevent tick bites or help reduce your risk of getting a tick-borne disease, it is do a tick check. Doing a tick check as soon as possible once returning indoors can reduce your risk of potentially getting a tick or vector-borne disease. And when you're doing a tick check, ticks can attach anywhere on the body, but they will often prefer areas that feel a bit more covered or enclosed. So places like in the hair, around the ears, along the waistband are all potential areas where a tick may prefer to attach. And if you do find a tick, you want to remove it as soon as possible. This video right here is showing one of my coworkers, I believe this is actually Erica, removing a tick. And as you can see, she is going to go in with a pair of tweezers and grab the tick as close to the skin as possible. And as she grabs on, she's going to start pulling up with those tweezers to remove the tick from the skin. They can really anchor themselves in, so it does take some force, but with a little bit of patience, putting a little bit of muscle behind it, it is possible to remove the tick this way. A couple of things I want to note from the video you just watched. First off, you notice that she grabbed the tick very close to the skin. You want to grab the tick as close to the skin as possible to help increase your chances of getting the tick out all in one piece. If you grab it a little bit further back, you potentially increase the risk of accidentally tearing the tick in half and leaving part of it in the body. So you want to get it all out in one go. And we also always recommend using a pair of tweezers to remove the ticks as opposed to trying to use Vaseline or nail polish or other methods, because this is the simplest and it will give you the best shot of getting a tick out quickly and all in one go. And so with that, the last thing I will say before I hand this over to the other folks to finish up this talk is that a lot of these personal protective things are probably methods that you've heard before, and they sound really simple when they're laid out in like a little 10-minute talk, right? With the slides, they seem like simple steps to take. However, it's not always that straightforward or that simple to actually implement these things in real life. And so as an example of this, a personal example I have of doing field work and trying to take these steps is that one thing that I always do for field work is treating my clothes with permethrin, right? Because I do a lot of work in really ticky areas, and it's a great way to prevent tick bites. However, to treat your clothes with permethrin, like is being done in that photo, you need to do it outside. This is not something that can really be done indoors. You want to be outdoors. And as long as I've worked with ticks or really ticky areas for about 7 years, I've lived in very small one-bedroom apartments. A very bleak photo on screen to illustrate there. And it's really hard to treat clothes with permethrin when you don't have access to an outdoor space. It makes it a lot more difficult. So in that case, I could say, okay, well, I can't treat the clothes in my apartment, but I could go to maybe a random parking lot, right, and treat my clothes and then bring them back with me, and then hang them out to dry where I live. But once again, I don't have an outdoor space to hang up clothing that has been treated. And inside, I've got a cat who, there she is, she gets to star in this presentation, and she loves laying on all my stuff. And if I were to take clothing that is wet, that's been treated with permethrin inside my apartment, I'd be potentially exposing her to wet permethrin, which, like I mentioned before, can be toxic to cats. And I say this example just to illustrate that it's not always that simple to implement these things. You can have all the knowledge in the world about how to prevent vector bites and still not implement it for different reasons. So how can we make sure that this knowledge of what we need to do to prevent vector bites is actually translated into action? And I'm going to pass it on to, I believe, Erica up next to talk a little bit more about how we actually do this.
Awesome. Thank you. Okay, so to kind of recap where everyone is, we've covered how to assess vector risk, how to stack that protection before and after and during field work. But even those strong, as Emily said, prevention plans can fail when it doesn't account for the people that are using it. They don't know what to do after exposure. And before I get into talking about workers' comp and reporting tick bites, I want to talk that it is important to separate two things. So what your institution or state requires and what you may decide is good field safety practices. So reporting requirements about vector bites or workers' compensation rules and coverage, they vary widely by state and institution or province and employment role. And if they have something, those are set as the minimum, but they don't necessarily represent the level of safety that you, if you're a supervisor or if you're a field worker, may want for yourself or your team. So your organization may actually have a lower standard for field safety than you do. So you want to know the requirements, but also decide what your team is going to have as a field safety plan, what you're going to document, report, and follow up on. So with that being said, we have to kind of start by understanding what applies before anyone goes in the field, right? So vector bites and vector-related illnesses or conditions like alpha-gal may qualify as work-related injuries or illnesses. But as I said, that coverage and reporting varies by state or by province, by location. Timelines vary. And on top of this, if you're an employee, or if you're a student employee, or you're an intern, a volunteer, or even seasonal staff, may all be treated slightly differently, particularly when fieldwork crosses state lines or goes international. So a question for you all, and you can put this in the chat, does your state or province or district governing body, other than your institution, but kind of broader, do they consider vector bites a work-related illness? Yes, no, you may not know, but feel free to put that in the chat. And it is important to determine before you start going out in the field, if that is the case. If so, what must be reported, how quickly it should be reported, what forms are required, and who is covered. So don't wait until somebody is sick to find out that the team or you doesn't know the process. So there we go. So reporting is more than an administrative requirement. Again, we're talking about reporting the vector bites. It protects the individual and helps improve field operations. So for the individual, it creates an exposure history. So if symptoms develop days or weeks later, and for the team, it can report or may reveal patterns connected to a specific task or site or season or lodging location, or even failure in protective equipment. And then for the institution, it supports a consistent response and follow-up and builds that institutional awareness and accountability. So it's recommended that reporting expectations are discussed with your team, or if you're a team member or an individual, with your supervisor before you head into the field and start whatever field work you may be going to do. And these are included as part of your field safety plan. All right, so the best time to develop a reporting plan, as I said, is before somebody needs it. So bite documentation may actually be given to you by your organization. For example, here at Penn State, we report on tick bites, but you also may need to create it. And I'm going to give a caveat here that much of this is very tick focused because they're obviously easier to track, but it is also important for mosquitoes or fleas or kissing bugs or other vectors that Drew mentioned as well. Just what that looks like in terms of reporting may be slightly different. So everyone should know what to report, how to report it, to whom the report is sent, keep the forms, phone numbers, links, or if somebody's super technology forward, at the apps accessible in the field. It can be useful to have a link or a QR code or the email for the contact person directly in a field safety plan that you've created for easy reference. So a kind of a useful test to ask yourself is if it's late on a Friday and you just got back or your team just got back from field work and someone removes an attached tick, does everyone know what happens next? If not, the reporting plan is not complete. So the reporting process. So the reporting process should be pretty straightforward, right? So you want to report promptly, provide the information currently available, complete any follow-up that's required. Field staff or you should not delay because you're not sure of the species or the attachment time or significance of the exposure. That uncertainty can be included in any report, and it can be updated if symptoms develop, medical care is received, or additional information becomes available. The process should also identify who is responsible for follow-up after the field day or seasonal position ends. So make sure those are in place. Make that reporting easy. So you want to make sure that folks actually do it. Keep the reporting materials in a field kit, include exposure questions in routine debriefs that you do with the team or with your supervisor. Use consistent expectations across teams and supervisors. So we have a field safety meeting at the beginning of the year with our field team, and we talk about this stuff and go through how to report. You want to report consistently based on your own standards and the requirements of your state or institution or province, whoever's directing that field safety, and document when the field plan could not be followed. So if clothing was removed because of heat or repellent was unavailable or lodging changed unexpectedly, those details are important not to hide. They give context to where the plan may not match real field conditions. And this is important because the culture should be to support bites or exposure. Reporting should be treated as that support system and not as a consequence. So some good practices are recording when the bite was noticed or the vector was removed, the location on the body, any immediate symptoms, what field activities were going on. It can be a good idea if you have a visible bite site to circle that or photograph it so you have some baseline for comparison. And if possible, not always possible, but if possible, if you found the vector, if you have the vector, save it in a sealed labeled container. That information can support identification and any medical follow-up. Okay, we're going to talk a little bit about roles and accountability as it relates to field bite safety. So in general, the organization is responsible for the safety infrastructure. Those of you who are at institutions where they talk about lab safety or other field safety, usually coming down to supervisors or field staff. So this can include practical training, access to protective supplies, clear reporting or occupational health pathways, and really secure handling of all health information. But sometimes organizational and supervisory roles get combined. So again, another example I have here at Penn State, nobody is going to provide hands-on training on repellent to my field staff other than me. So I need to take on the role of the organization in many respects and that of the supervisor, because even though my institution has a policy about field work, that policy alone is not enough. The organization has to provide those resources and the systems that make the policy realistic. And often that, as I said, that comes down to the supervisors. So the supervisors are the ones that are assessing the changing conditions, implementing protective measures, ensuring supplies are available, and modifying the plan as you run into heat or vector pressure or lodging or tasks change. It also establishes that reporting culture. So when somebody reports exposure or raises a concern, the first response should be support and problem solving, not blame. People will decide what to do in the future based largely on how that first report is made. And the individual is responsible for using that protection correctly. So conducting the vector checks, reporting exposures, doing whatever the field safety plan for vector exposure has been detailed. And they should also speak up when PPE doesn't fit or the heat becomes unsafe or another barrier makes the plan difficult to follow. That communication is really important. It's not a failure to comply, but it's part of that safety process. So those individuals should also be actively involved in any trainings or briefings and to support other colleagues, especially newer ones, as they navigate field safety as well. Okay. So we've given you many components of a field safety plan, including that risk assessment, reporting, stack protection. Equity, accessibility, and accommodations are often overlooked. So a safety plan can look very strong on paper and still fail if people can't afford it, can't tolerate it, can't understand it, or physically can't use the recommended protections. Emily mentioned some of this as she was finishing up. So accommodation planning should happen, again, before field work and not when somebody encounters a problem. We want to normalize the conversation and give participants opportunities to identify barriers without requiring them to disclose any unnecessary personal information. So for example, 1 year I had a student who just started a new medication and she learned that it made her less tolerant to heat. So we had to adapt her role in the field accordingly. We want to provide multiple PPE or repellent or check options that offer comparable protection. And field activities may also need to be modified. That could be task rotation, making sure there's shade, hydration breaks, or schedule changes to reduce exposure intensity. So the goal is not to lower the level of protection, but to find a protection strategy the person can actually and consistently use. But to do that, we have to kind of recognize the barriers that may make that those standard recommendations difficult to follow. So some barriers are obvious, but many are not. People may be expected to purchase their own protective clothing or repellents or other supplies, which may be a financial barrier. Long clothing may reduce vector exposure, but increase heat stress or fatigue, or there could be sensory discomfort under real fieldwork conditions. So the plan itself may also be a barrier. So the instructions could be too complicated, or the reporting system may be difficult to access, or people just hesitate to report because they're unsure whether an exposure counts, or fear that that reporting would be viewed negatively. So rather than assuming somebody's not complying, we want to ask the questions, what is making the recommendation difficult to follow? And some tips to think about when you're thinking about reducing barriers. So clear communication, that's a safety measure. Using plain language, translating materials when needed, and providing visual support, such as a pictorial PPE guide or simple checklists. Demonstrations are often more effective than handling someone a written procedure and assuming they understand. So we spend one day just putting on our coveralls and wrapping our tape and putting the repellent on it so everyone understands exactly what's expected. Buddy systems can also help with language barriers. They don't replace translations, but they can help. And everyone should know whom to contact and what will happen after they raise a concern. People are more likely to act quickly when those instructions are clear and they feel safe reporting bites exposures, or they feel safe when they bring up concerns about accessibility. So now I'm going to hand it off to Dr. Trout-Frixell to discuss more on communication and global considerations.
All right. So thank you, Erica, and everyone else. So there are different ways that we can effectively communicate, and Erica mentioned this a moment ago with, being clear, being concise, being coherent, being courteous, doing this active listening, and then receiving feedback while you're doing this too. I know sometimes when I talk to students in the classroom or students outside, I really like to see when their heads are nodding, so I know they're actively listening and giving me that feedback. They're taking it in, or I'm assuming they are. It doesn't mean they actually are. Hopefully. And so there are things that are already out there that the CDC has developed for you, for those of you in public health who are interested in being able to communicate with others. And that's what I'm really going to talk about here. And so they do have communication resources that they've developed to help state and local professionals prevent a variety of, mosquito, tick, and other vector-borne diseases. They have a campaign out for Fight the Bite. This material that's out there is, there's a number of graphics, there's social media posts, and they've all already been kind of looked at. And so there are things available for you to communicate this really clearly. The other thing is there are press kits that are out there for you if you get questions from the media, specifically when you think about alpha-gal right now in the news, you can go to these websites, you can get this information and provide that information back to the media resources very quickly. And I just put in some QR codes in the next few slides if anybody's interested in going to those websites with their phone. But really, what Erica mentioned too was tailoring the resources for the audience. And this is something that's really hard for a lot of scientists and academics and professionals because we don't want to be talking to ourselves. We want to be talking to others. So the audience is not you. You have to remember that. So you do want to identify that target audience. Who are you working with? Who are you communicating with? You're not communicating to them. It's an active engagement. There's feedback involved. Are you using appropriate language and graphics? Do they actually hear what you're saying? This to me, this graphic that was created from the CDC website is something that different summer camps can use to give to students when they're coming out, some different kids going to summer camps, how to make sure they're looking at themselves for ticks and what they're doing. So, this is really nice. It's pictures of kids out in the field doing things, finding ticks, and then reporting them too. And so, it's a kid reporting it to another, to an adult later on as well. It's also important to make sure that you're using your trusted resources. So where the audience that you're communicating with, where do they actually get their information? Making sure that you're interacting with those individuals too, to make sure that that trusted source is there. And so here you can see the CDC has put their emblem on their logo to make sure that, this is the trusted source. This is CDC that's created this. And really the thing that we've been noticing, here, not just at the University of Tennessee, but in the VectorED program is, identifying a real solution to the problem. How can you teach the audience to solve their problem? And so Emily spoke about this when, she had the problem of, I've got a cat, I've got a small apartment, how do I treat my clothing? She presented to you all a real solution to to that problem. And so this was something that I created back in 2022. We had a number of lacrosse cases that came out in Knox County, Tennessee. And so the VectorED Network, UTIA, the University of Tennessee, Knox County Department of Health, and Tennessee Department of Health came together to develop a social media campaign so people can kind of learn about lacrosse virus kind of very quickly. And so we made this infographic quickly in response to these cases. And I'm making myself vulnerable here to let you know that after doing this and learning more about communication, do not think this is a great infographic anymore. While we have, I'm not sure if you can see my mouse, but on the bottom, the trusted sources, we're not really giving people the information that they need. So we're telling them to apply, thanks Emily, EPA approved repellent, but we're not telling them where to get it or what it is. We're asking them to dress their child in clothing and cover arms and legs, but maybe there's no demonstration here. Control mosquitoes indoors and outdoors, and we don't have that information provided. And really, we're just giving them a QR code to stay informed. And so, maybe that should have been bigger with like, go here for this information. And so while it's cute and it has our information attached to it, I'm not really sure it really conveys the message that we were aiming for at that time. And so one of the things that we've done as a part of the VectorED network is really kind of refocus and realign ourselves with trying to figure out how we can do a better job of not just developing these materials, these educational materials, but these reviewing these materials as well. And so on our VectorED network, there's a link here, the QR code for the antenna tool. This is a really nice program to help you kind of identify the strengths and weaknesses in the materials that you might be developing, not just for your programs and your if you're a supervisor, but for the people around you, but also if you're talking to the public as well. And so they're really focusing on making sure that the visual design is there, there's targeted messaging, that there's certain sets of standards available, content is there, and really that there's some kind of action that you're requesting the individual to do, that it's action-based that leads to a real solution. And so I think the CDC really did a good job recently with the World Cup. We just hosted it and Spain won. Congratulations to Spain. They have material on the website to help protect people who are coming to the US for the first time, so that they stay healthy in the States. We have issues here. We have a number of mosquitoes and ticks that we've talked about, how to keep people healthy here. So, World Cup for your health. But we also need to remember that we travel a lot for work. We also might travel for vacation. And so the CDC has also developed a variety of materials that are out there for you to kind of make informed decisions before you travel, while you're there, and then what to do when you get back. And a lot of this is found in the CDC Yellow Book. And so in the Yellow Book, it really breaks down to what Emily talked about a moment ago. What you want to do before you go outside, before you do field work. If you're a supervisor, what you want to do before you send people out. While you're outside, what you should be doing, and then what you should do when you return. And so it has information on pre-travel consultation, travelers' perception of risk, information on vaccination, immunoprophylaxis principles, if there are different recommendations or requirements to enter those countries, such as having the yellow fever vaccine and malaria prevention information, as well as travel health kits. And I believe I saw Darlene had mentioned that, OSHA and others also have information, on kits on what you should have when you're doing this type of field work. And so this is thinking again, that our local problems are just as global as well. And so I was a World Cup watcher, I guess if you was an observer. And one of the things I was watching was the Cape Verde game. I believe it was with Spain. And some of the things that I was noticing was that the country was trending at the time on Google. I thought that was really great. But people were looking like, ooh, do I want to go there? Maybe they want to go and meet the keeper, that amazing soccer keeper, who was doing a great job. But what are the activities that they're doing? When you go to these destinations, what do you want to pack? How do you want to travel? How are you going to get there? If you're going to a country that has a variety of islands, are you going to be traveling by boat? And if you're by boat, are there going to be mosquitoes on those boats as well? Making sure that you're protecting yourself wherever you are. Will you need the yellow fever vaccine? According to the CDC, and then the Cape Verde country website, you don't need the yellow fever vaccine if you're originating from the US. But if you're coming from another country, you do need to present the yellow fever card. You do need to be aware of dengue and Zika virus, African tick bite fever. What repellents do you want? What type of clothing are you going to be wearing? What type of repellent, as well as, how often do you need to reapply it? And one of the things I like to talk about with repellent is I like to think of it as sunscreen. If you're in certain areas of the world, say you're closer to the equator, you're going to have to reapply sunscreen on a more regular basis than you would if you were in Pennsylvania or anywhere north of there. But that's the same case too as repellents. You might need to reapply not just once, but maybe twice in order to ensure that those mosquitoes and ticks are staying away. And then also what kind of medical care you might need while you're there. And so the CDC does have information for a variety of countries that you can get, if you're sending somebody, an employee abroad, or if you're traveling abroad yourself, or if you're communicating with others, how to do this. And I believe I'm handing it back to Erica.
Yes, you are. Thank you for transitioning to that slide. So we have now talked about the vector risks across different locations, globally, locally, and communicating with different audiences, and covered risk assessment and protection, a whole bunch of different things. But again, and Emily kind of summarized this very well when she said knowledge doesn't always equal action, right? And knowing what should be in that field safety plan, or when you think about your own safety, doesn't guarantee it's going to work. So I want to kind of end this by looking at where field safety commonly breaks down. And one of the most common failures is that the safety plan exists, but it's not part of your everyday operation. So it sits in an office or shared drive or in a vehicle, and no one regularly uses it. Or prevention is treated almost entirely as the individual's responsibility. So yeah, just wear the right clothes, apply repellent, and check yourself. But the organization and supervisor still have to think about the supplies, the training, the time, the support. And plans also fail when they're inaccessible, right? So supervisors assume everyone understands the risks, because they do, but maybe no one updates the plan as sites and weather, personnel, and field conditions change. So a good field safety plan should be discussed, should be practiced, should be reviewed and revised, and not just completed. It should be something that is an active part of your field safety. Oops, skip one too many. There we go. Okay. It also fails when protective measures cause another hazard. So long pants and additional clothing may reduce tick bites. They can increase heat load or fatigue and discomfort. Gloves may provide protection, but they may reduce dexterity. Repellents or fabrics or gear may be difficult for some people to tolerate. So these are trade-offs that become more significant the longer the field day, especially as people are becoming tired or they're just trying to finish the work. So the answer is not to abandon protection, but to plan for realistic alternatives. So either that's different PPE or more breaks or task rotation, or access to shade and water, as I mentioned before, schedule changes. So again, the accommodation is only going to be useful when it works under those real conditions. Another failure point, again, is that knowledge versus action. Most field professionals already know what to do. They know they should use repellent, they should conduct tick checks. Information is usually not the missing piece. What's missing, or what often happens, is folks are hot or rushed, or I'm just going out in the field for a minute, or they're maybe embarrassed, or we all dress up in especially our tick prevention clothing. It's not like the most fashion forward, or they're focused on completing the task. So it's kind of normal human behavior, and we need to design that work around it rather than assuming another reminder slide is going to solve the problem. So we want to build prevention into the routine. You can use phone timers or buddy systems or schedule tick check breaks or end of day procedures when everybody comes back. So make time for these steps and everyone's kind of checking on everyone's doing this. So we want it to be part of the process and not something folks are just squeezing in. So we want to try and make it the safe action be the easier one and the more automatic. And with that, I am going to hand it over to Dr. Tufts to wrap us up.
All right, thank you. So I just want to not spend too much time on this because we've covered this a lot. So this was just kind of a summary slide here, and we are running out of time, so I'm going to kind of skip over that for a minute. But I do want to thank all of the presenters. Thank you for providing all of that great information. So as we're finishing up a few things here before we get to the Q&A, first I wanted to note that this presentation is for educational purposes only and is not intended to be a substitute for veterinary or medical advice. And I apologize, I don't know why my camera's not working anymore. So advance, there we go. So for our next webinar, in this professional development series, we're excited to have Dr. Yotam Ophir from the University of Buffalo coming to talk with us. And this is going to be about understanding false information. So this will be held on August 26th at 1 p.m. Eastern Time. And you can register for this webinar by using this QR code on the slide or by going to the web address listed. And these are links that can be also found on our LinkedIn page and the VectorED Network website. So we also invite you to sign up for our monthly newsletter that provides updates on trainings, jobs, and new information on vectors and vector-borne diseases, and to access past recordings of the webinar series. So please use these QR codes or the web links to find this information and more on our website. And I will drop some links in the chat in just a second. So finally, we have one more request of all of you, and that is to do a short evaluation of this presentation so that we can continue to get better. You can use this QR code, but you will also be prompted to take the evaluation after you close down from Zoom. As always, many thanks for your participation. And it doesn't look like we have any questions in the chat. Yes, Darlene, I will put that those links in the chat. Trying to work through 3 different pages here. So there's the links in the chat. There was one question earlier, which I did answer. It said, can you enlighten me more on how clothes removal should be done after the field to prevent infecting your home with vectors? And I recommended, said that we recommend putting the clothes directly into the dryer for about 20 to 30 minutes, which should kill the ticks. But does anyone else have any suggestions for that also?
I'm happy to add to that. Not everybody has a dryer that's easily accessible. You can think of it as Emily's apartment. Maybe she doesn't have a dryer in her apartment. She had to go down the hall. We use a lot of Ziploc bags as well. And so if your clothing has ticks on it, or you think they do, the information that others provide about bed bugs and being able to put your clothing and folding up and putting them in large gallon Ziploc bags or even trash bags, at least the ticks will be contained in that location before they escape and you have a chance to take them to the dryer.
That's a great suggestion. Thanks, Becky. So if anyone has any other questions, you can please put them in the Q&A or in the chat. I know we're a little bit over, but if you guys have questions, please let us know. So Joellen Lampum said extra large Ziploc bags can also protect your vehicle. So yeah, if you can maybe take your clothes or other field equipment and put them in the bags to protect your vehicle, because I know I've seen them as I'm driving and I thought I did a good tick check. So and then Darlene Harris said, if any presenters would like to consult with me about developing a presentation for green industries, please contact her.
Sounds
Did we
good.
lose Erica? Did
Yeah,
she?
I think Erica might have jumped off, but I can answer yes. Darlene, I can send, as long as you inputted your email when you registered, I can shoot you an email either later today or tomorrow, and we can chat about what you need to develop that presentation. Absolutely.
So I'm not seeing any additional questions. Thanks everyone who decided to stay a little bit late, and thank you again to all of our presenters.
All right, and then we had one other question just as everyone logs off for the day about receiving webinar recordings. So we should be sending that recording out. You will get an email about it. It should be out within about 7 days or so after this webinar. We try to get them out a little bit quicker, but sometimes if the technology is slow, it takes a little bit. But you should get an email about it within, like I said, within 7 days or so. If you do not receive an email about it, please feel free to shoot us a message. Let me go ahead. I'm going to go ahead and just put my email in the chat really quick. Or I guess, Olivia, would you be the best person to reach out to for the webinar recording?
Yeah, I wasn't sure which Penn State webinars they were referring to, if they were other extension or these, because we haven't had one since May or so, but they should get sent out. But yeah, you can feel free to reach out to either of us. I will put my
I think was that whoever asked it. I put a link in the chat just a moment ago, and at the very bottom of that website, it says past webinars, and there's
yeah.
a button that looks like I can watch it. I haven't clicked it to confirm, but it says watch recording, and it looks active when I scroll my mouse over it or my
Yeah,
cursor.
so just in case something messed up with the emails, we don't send those out, our Penn State team does, but they will always be posted on our website if not. And that's just for the VectorED Academy, not for any other extension related. Yeah, thank you.
All right, thank you everyone. Have a good rest of your day.